Hello everyone, I'm Natalie Kunzman, MD, and today we're going to talk about why your thyroid is off. So today we're not going to talk about some of the very obvious things such as tumors, surgery, cancers, or damage to the thyroid such as radiation, or any of those genetic disorders where you're born with a small thyroid, non-active thyroid, or no thyroid at all. So those are discussions for another day. What I'd like to talk about is those of us who may have started out with a nice normal thyroid, but why did it become off? So I think of it in several different categories, and one of the first categories we're going to talk about is the hormonal influence of especially us ladies and our hormones and its interplay with the thyroid. So if we wind up being in an estrogen dominant phase, well, that actually means that too much estrogen without any progesterone, that's offset. And I have YouTube videos on hormone discussions. So let's say we are in an estrogen dominant state. Well, there is an interplay, especially with the Hashimoto's and autoimmune conditions with that thyroid, that the estrogen has an influence with that thymus gland that starts out very big when we're little, involutes as we get older, but this thymus gland is responsible for a large portion of our immune system. And B cells, which make antibodies, wind up getting influence with this excess estrogen and actually can be stimulated, inappropriately so, and can start generating some autoantibodies. So those antibodies to the thyroid, anti-TPO or anti-thyroglobulin antibodies, may not cause a problem initially, but as there may be more of them, if they get into that thyroid gland and start rendering it hyperfunctional or non-functional, it could actually start damaging the thyroid cells, and ultimately we wind up having a thyroiditis, an inflammation of that thyroid gland. So that is an interesting interplay that not everybody makes the connection. The other reasons why your thyroid could be off are reasons of what I would call disorders of manufacturing thyroid hormone, or actually conditions or substances that try to impact the thyroid synthesis. And don't forget, the thyroid gland secretes mostly T4. T4 needs to get converted into T3 to its active form, which plays a role further on in our discussion. So in my mind, some disorders of poor manufacturing of thyroid hormone really get down to the building blocks of what the thyroid needs to make thyroid hormone. Most of us realize that it needs iodine. So we need iodine. So if there's iodine deficiency, we can develop underactive or goiters, which was common back many years ago. But we also need some zinc and selenium to help with those conversions. And we certainly need those substances that are necessary for mitochondrial health, which are the B vitamins, sometimes alpha lipoic acid, and magnesium. And this is because the cells in the thyroid gland use a lot of energy for its production. So if your energy is down, your production is down. So we need what I've always described to my patients as thyroid food. Now there, as a sidebar, there are some foods that can actually render the thyroid underactive, and that's a lot of the cruciferous vegetables such as broccoli, cabbage, cauliflower, Brussels sprouts, and that can render the thyroid underactive as well. So, other deficiencies that could cause diminished production of that T4 would also be copper and vitamin A. And again, don't forget those B vitamins as well as vitamin C. So if we're deficient in any one of those, we may be deficient in production of thyroid gland or thyroid hormone. There are also things that can stress out the thyroid gland, for lack of a better word. Some of those are the deficiencies that we talked about, but also starvation states. And the reason some of these starvation states and its production of T4 is the body needs 5-deiodinase, which helps with its production and or conversion of T4 to T3. Put that in mind with stress. So when we have a lot of stress, and that can be body stress, it could be psychological stress, we're actually increasing cortisol levels, and cortisol levels will block that 5-deiodinase production. So it's actually going to block the conversion of T4 to T3. So stress, starvation, an inadequate protein intake, and sometimes that can go hand in hand with the starvation state, but even some liver conditions will be deficient in protein synthesis or contribute to protein losses, as well as kidney disease if that is occurring. Now, chronic illness, so a protracted infection, protracted autoimmunity from another cause is actually a body stress and can also slow that conversion down from T4 to T3 and render our thyroid hormones low. If we have super high carb intake, too much sugar, boy, is that a thyroid disruptor if I ever knew it. We also have noticed that simply the aging process and additional fluoride in our water sources and what we are using for our teeth. I view that fluoride as booting out the iodine and rendering that thyroid inactive. And this is something that maybe my dental friends would disagree with. Fluoride is a whole other discussion, but when it comes to the thyroid does not like the excess at all. The thyroid also does not like pesticides, nor lead, and copper, or some of the mineral excesses. We have a heck of a toxic environment. So some of the dioxins and the PCBs and some of the plastics and phthalates and chemicals rendered to make these substances run interference with that thyroid gland, as well as other things in the body, but the thyroid in particular becomes underactive or inflamed with this. Now, we talked about the estrogen excess, but also at the adrenal level, if there's not enough DHEA produced, DHEA and cortisol run a balancing act at the adrenal level, and that also can impact thyroid levels. So there are ways that we will combat these issues, and that's where the functional approach comes in, because we can figure out, A, if you have autoimmunity to that thyroid and what to do about it. We can figure out if you are deficient in some of these minerals and what to do about it. We can also do salivary hormone levels to watch the interplay between your sex hormones and pituitary hormones and thyroid hormones and figure out what to do about it. We also can figure out the sugar and the insulin and the cortisol interplay between the thyroid and what we can absolutely do about it. Some of the treatment arms of the thyroid can be quite novel, such as thyroid massage and light and energy therapy, particularly red light. The supplemental factors to help, as well as compounding and natural hormones in addition to medications if necessary. That thyroid is in charge of a lot of processes in our body because it is the master conductor of not only some of our hormones, but actually our cellular health and our cardiovascular health. So if you don't think that thyroid is important and you don't protect that thyroid from here on out, you may wind up having some chronic illnesses that could have been prevented. Of course, this is where the functional approach comes in. I listed several reasons why that thyroid is off, but there may be some that are unique to yours that will need attention. You can figure this out by obviously consulting with me online or another functional provider. I'm Natalie Kunzman, MD. Subscribe to my channel below. And until we meet again, be well.